You're listening to another episode of Badass Mums.
I'm Tneek, a female rapper and bid professional.
I'm Shahlaa Tahira, presenter and content creator.
And I'm Cilla, singer-songwriter and all-round creative.
Together, we are Badass Mums. Welcome back to another episode of Badass Mums. Today we're doing something a bit different. This is a special bespoke episode. We have two guests from St Pancras Clinical Research, Dr. Alishah, Suleman and Andrea. Hello.
Hi.
How are you guys?
Good, thank you. How are you?
Good. Yeah,
Very
we're good.
well.
Yeah.
Excited to have you on.
We're excited to be here, yeah.
So tell us a bit about what you do at St Pancras Clinical Research and why you're on this specific episode, like what you're bringing.
Okay, I'll let Andrea go first.
So as they mentioned, my name is Andrea. I am a study coordinator at St Pancras Clinical Research. Been doing the role since about Feb, but I've been in the company for just under 2 years now. And we're here to talk about postpartum depression, research, just give people exposure to that side of the world, because I don't think it's a lot that people know about. So yeah, that's what we're here to do.
Nice.
And my name is Alishah. Like you said, I am a medical doctor. I have been working as a research doctor for about 1.5 years now. And I think this particular podcast is very special to me because I just had a baby.
Congratulations.
She is 5.5 months old.
Wow.
So-
And you're at the house and you got makeup on and
Yeah.
you're so stressed. Well done.
Winning.
And believe it or not, today is my second day back at work. So this is actually quite So this is a topic that's very dear to my heart, and being so close on the other side, I think that I would be able to shed a little bit of light in terms of the doctor side of things and the medicine side of things about postpartum depression, and then also from a new mom side of things. It's of both. So I think it's just the right experience to be here.
Yeah. We've got the best people to talk about it.
That's it. Hopefully we can shed some light and, be a little bit more encouraging about people speaking up. And
Yeah. So what would you say, because I feel like I had postpartum with my daughter, but undiagnosed.
Okay.
Yes.
It's only now learning what postpartum is that I'm like, oh yeah, that's why. So what would you say are like some of the signs you can look out for to know if you are going through it?
Right. So it's very interesting that you mentioned that, because you're right. There's a lot of things that moms go through that almost, there's two parts to it. One, we make ourselves feel like it's not okay to feel that way. You're a mom. You have to be your best for your baby. And, so the first aspect is to tell yourself it's okay to have feelings, whatever they are, whether they're excited feelings about having a baby or whether they're not so happy feelings. It's okay. That's what you're feeling. Now, the second part of it is to be able to identify whether those feelings are okay to have, to what extent are they okay to have, versus when is it not okay, and when do you want help, when do you ask for help, when do you, when do you voice that this is how you're feeling. And it's unfortunate, really, because there's a lot of stigma, like you said, moms, we just have such a burden where, you have to be pristine and, you're the best mom, you have to do this, you have to do that, feed your baby, clean your baby, make sure they sleep right, make sure they do this. But in the background, you kind of lose yourself, and that's where it gets to you, and that's where it kind of starts dragging you down. So to a certain extent, what they call baby blues, just after baby, those are okay to have. You're okay. You're allowed to miss your previous life. You're allowed to miss baby free time. To a certain extent, those feelings are okay. The first couple of weeks, you're settling in, everything hurts, feeding hurts. You just delivered a baby, your labor might not have been the best, there's so many aspects to it. But when those feelings linger on, when they get so intense that you don't want to get out of bed, you don't want to, you stop looking after yourself, you are very irritable all the time. Now, don't get me wrong, the hormones make you quite irritable anyways. But there is all those little signs that start creeping in. You don't sleep very well, or you sleep too much. or you don't eat very well, or you eat too much, or you start, craving all the junk food and you're not looking after yourself. And, you just feel like, what's the point? I have to do all of this. And those are the signs where you should start thinking about maybe talking about your feelings or reaching out for help. They don't just say it takes a village. It really does.
It really does.
It really does. So those are little bits and pieces of signs that kind of creep up. And if that's the case, then I would say, speak up about it. I'll be honest, I'll tell you my story.
Yeah.
I did not have a very happy birth where I went in and everything was fun and games and baby came out and all of that. No, I had it became very scary very quickly. And even though I was a doctor, I had an emergency. They had to rush me. I lost a lot of blood and it was quite traumatic.
Yeah.
So, and then you get home and you're just handed another living being to look
With no
after.
manual.
Yes,
Just get on with it.
And they're like, here, go for it, you know? And I think after maybe 2 or 3 weeks is when it dawned on me, the intensity of what happened in the hospital. And then I sat down and said, gosh, that shouldn't just be accepted as, yes, this was labor. No, that was quite intense.
Yeah.
And then you're still recovering from that. So, there's all of that. But then you kind of have to shove all of that aside and then continue.
Yeah.
So, any normal person, those feelings will start creeping in.
Yeah.
And I had a chat with my health visitor. Health visitors, they come home and they have a lovely chat with you and stuff. I had a chat with them and they said, it was very nice. The one big thing that they told me to do was take time for myself.
Yeah.
Now, you all are moms and mom guilt is real.
Yeah.
I had one coffee 1 month after my baby, and that 15 minutes was the hardest 15 minutes. I left home and I kept calling my husband every 2 minutes, like, is she okay? She's like, she's asleep. She's still asleep. She's still asleep. So that's the very important thing. Take time for yourself.
Yeah.
That's the first step to make sure that you are still that person that you are. You haven't put yourself aside. You haven't forgotten about yourself.
Because I find as well in that first year, especially when the baby needs his mum so much, it's so hard to take time for yourself, especially if like you are a single parent or you haven't got like support around you. What would you say to those mums who are feeling these emotions, know they need a break, but it's almost like mission impossible? Because they always say it's about sleep when the baby sleeps, and you're like, we talked about this on another episode. No one does that.
No one does that. And I have a feeling that whoever came up with that never had a baby, because there is no way that's happening.
Yeah.
Even when the baby is sleeping or not sleeping, you're not sleeping. There's no sleep there. You know? But no. What I would say is, for people who are struggling, the first and most important thing is identifying it.
Right.
So saying that I am finding it hard is okay.
Yeah.
You don't have to be super mom all the time. We all have bad days, and it's okay to accept that we have bad days.
Yeah.
Every day cannot be a good day.
Yeah.
That's it's an impossible thing.
Yeah.
So it's okay to have a bad day. More importantly, speak to somebody, whether it's friends. If you don't have family around, speak to a friend. I found that my little NCT group of 7 moms that, kind of gave birth around the same time was very helpful, because we had our own little coffee mornings and, we had our own little stories about venting a little bit about how our other halves are,
That's what we be doing.
Yes, that's it. How our other halves are struggling so hard with settling in, And so that was one source of very of support. The other thing I would say is your GP. Speak to them. They have a lot of resources. They can refer you to the right people. You can have a chat with your health visitor. They are very willing to sit down with you, provide that support. Now, I know that, this all sounds very rehearsed, but there is help out there. Yeah. The most important thing is to get rid of that stigma that we have, that you have to put up a front of, if you have these kind of feelings, you're a bad mom. There's nothing like that. Yeah. If you have feelings, if you talk about them, they'll get resolved. You can move on. Yeah. The more you suppress them, the worse they're going to come out later.
Yeah.
So how did you find when you went to your health visitor about it? Because
sometimes it feels like there's a thin line. Like they ask questions, are you okay? Are you being harmed at home? And they ask the guy to leave the room sometimes. So sometimes it makes you feel as if, can I even be truthful? Are you going to start assuming
social
there's
is
a
going to get involved.
issue, there's a bigger issue, and then they put you on the map sort of thing.
Yeah, and absolutely. And I think that's the reason why a lot of us don't share these things. But what you have to realize is most of the health visitors, I think a really big percent of them are moms already, so they have gone through what you've gone through. I will give you a very personal example. So the coffee that I was talking about, the 15-minute break that I took, I was feeling I was at a place where I was like, you know what, there's this very real concept about being touched out, like, baby's feeding all the time, your husband wants to, give that support, so wants to give you a hug, mom was there because grandma wants to spend, and you just feel like there's too much, just leave me alone.
Give us some space.
Yeah. So then my very loving husband suggested, why don't you go out for a coffee? Leave baby with me, I will look after her. And I was like, why are you taking my baby away from me?
Oh, yeah.
And those were just hormones, it was just like, I just immediately went there. I'm like, why are you, and I shared that incident with the health visitor, and she very lovingly said, she was like, you have a good man.
Yeah.
You have a good man. She's like, don't think like that. You have a good man. So they are very keen to listen, and I think they do. I don't know where the misconception comes from, but they do they do support in as much as they can, and they're the ones who suggested do coffee mornings with your NCT group, come to us, and we have free clinics, we have a nice center where you can come and sit down if you want to take a break, do it. So there's a lot of support that they're willing to give, but the first step has to come from us. You have to take that first step.
Would you say, like, for me personally, I feel like I experienced postpartum quite instantly after, but then I shoved it away to where I didn't really recognize the signs, and I thought it was just baby blues, I guess. And it was only probably 2 years after that, but then by that time the health visit appointments kind of slowed down, obviously. And I wasn't able to, or I didn't understand where to go to get help. So for me it was like, okay, try and talk to your doctor, and then they give you a therapist. So is it possible to experience it much later?
So there's postpartum depression itself. If you look at the definition, it's from birth to 1 year, any time between that.
Okay.
What you're talking about is a little bit more of unresolved feelings. Now that's another important bit, because if postpartum isn't identified, isn't treated the right way, if you don't have the right channels to kind of experience your feelings, it can then lead to long-term issues and like mental health problems and things like that. So you are basically the example of why you should reach out at the time. But like you said, if you didn't know what you were going through, how would you know how to deal with it? So that's why today's podcast, we want to be able for people to be able to understand, and even if we're able to reach out to one person who says, hey, hang on a second, maybe this is something I'm going through, I think we've won.
And essentially with that system as well, when you go to the doctor and you get a referral, it takes forever. Like literally, you could be waiting like a few years basically. So in that sense, I feel like maybe this is something to look into. There's an alternative option to deal with postpartum or past that 1 year period. So yeah,
absolutely. Another fact that I actually wanted to bring up that a lot of people don't know, I don't even think if Andrea knows this, but do you know that 1 in 10 men or partners experience postpartum depression as well? So
I think it'd be higher, because the way they handle their emotions around people, I think it's 5 and 10. They just won't admit it. Do you know what I mean?
So I mean, it's like we always say, you're in this together. So as much as I do understand that we have more of the burden of baby, looking after baby, feeding baby, making sure everything is fine, they do experience their own side of things as well. So it's nice to acknowledge our partners and kind of check in and make sure that they're okay too. So
I think that's why there's a lot of difficulties after there's a new baby in relationships. I feel like it's a really tough time for couples in general across the board.
That's very well said, I must say, because I think some people, because of that, just go, I'm one and done,
But I think it's normal, because it is such a life adjustment. Like Alishah was saying, now when she goes home, it's not a case of putting your feet up. You're actually going back to another human being. And me and my friends always joke, imagine you've come back from a long day of work and you've got someone at home saying, "Mummy," like you don't have yourself anymore. So I think it's such a huge life adjustment, not just for you, but for your partner as well. And in terms of postpartum depression, I think depression in itself is something that people struggle to identify, let alone something that's because of something that's supposed to cause you a source of joy. So I think that's where it comes from, that confusion that this is my baby, I should be happy, especially when the family comes around. It's like, oh, we've got a new baby. But then what about mum? Like, are people checking in on mum? And an example of this is like when you go to a baby shower, everyone buys gifts for the babies. I think I had the friend who was like, oh, what should I get for the mum? And I was like, I've never actually thought about that. Like buying something for the mum for maybe after she's given birth or during the pregnancy. So I think with these huge life adjustments, it's identifying that yes, it's going to be such a huge change, but it's okay, and it's okay if I don't know what to do, and who am I going to speak to guide me in that instance.
I want more friends like her.
It's true. No, we get forgotten about. It's all about the baby.
And in turn we kind of put ourselves in the back as well. So if because everybody is so focused on baby, you feel like, oh, hang on, I shouldn't be feeling like this. And then it kind of then you get scared. If I tell somebody, they will be judgy. How will they look at me? They will, and all of these things, So the important thing is voice it. A lot of people, including maybe even our parents who don't want to share things with us.
Yes, to the next level. I feel like the older generation is even worse.
But surprisingly, the more I've shared with my mother, the more she has been able to open up about her, and I was like, oh, I didn't even know this, Mom, and she was like, well, I guess now you're at a stage where you can understand. So I think it's almost generational that we're able to get our previous generation to open up about mental health concerns and things, which is a big deal.
And I do, on that note as well, I do feel some of it comes from culture as well.
Yes.
I think that's very big.
In black culture.
I think there is a huge pressure on women as well, which is why they might feel a bit of a way to opening up and being honest. And feeling like, am I going to appear to be weak, sort of thing.
And like you said earlier, and like you said earlier, that if I say something that, for example, take my example, if I say, oh, I want some time away from baby, well, they take baby away from me. They feel like I can't look after baby. But having your me time is very important as well. I mean, it makes you a better
birthday
mother.
Now I take myself out.
There you go.
My birthday
Exactly.
You deserve it,
You have to celebrate. I'm going to. I know I'm going to.
Over the year. I'm celebrating.
No, I definitely feel you on that, Tneek, because I'm not going to dive too much into it, but culturally, my mom, it was just like, well, mother's got to stay with the baby. Where are you going? You got to stay with the baby. What are you doing? Go back with your baby. And it's just like, she kept me so like attached to him to the point where it's just like, I couldn't get that me time. Or if I tried to, it was like, well, you're the mother, you're meant to be with the baby.
That make you feel guilty for wanting it.
Feel guilty. And that definitely contributed to just feeling suffocated. I feel bad for saying it, but suffocated.
Absolutely.
I think even touching on that, I don't know if it's just a Ghanaian thing, but when you give birth, it's like the person wouldn't go to church for, let's say, 3 months, or they can't leave the house and be seen out in public. So I'm thinking...
Yeah, in my culture, it's 40 days.
Yeah.
Oh, really?
Wow. Yeah, but you are meant to stay at home. And I was like, that is not happening.
River was like 4 days old, and I was like, let's go Tesco's. I just need to go out. I just need to get out these 4 walls.
You can imagine it's a lot. But obviously, as the younger generation are coming up, it's something that's changing. But you think you've given birth, now you just have to stay at home with the baby, and it's just like, you can understand why some people would then go into that depression, because it becomes a cycle. Let's say if you're not able to then do what you used to do, you're now just stuck doing just the same thing over and over again, and you lose yourself, you lose your interest, your hobbies. So I think, like Alishah said, taking that time out to treat yourself, because you can't really look after your baby if you're not well. Can't pour from an empty cup, sort of thing. So I think one thing our generation is doing quite good at is looking after themselves and putting themselves first so that they can be better for someone else, which is really nice to see, because it's not something that like my mother's generation have been doing. It's always been sacrificial, and now you're seeing the effects of it. Like when they come back from work, they're tired, and you can see like it's weighing on them, but what can you do? So I think it's good that we're now speaking out and taking care of ourselves as well.
Yeah, and looking after yourself is not selfish.
Yeah.
That
Yeah.
needs to be out of our selfish. The word should go away from the dictionary.
Yeah.
It's not. It's your time. You need that. You need to regenerate. You need to make sure that your batteries are charged for your baby, for your family, for that matter. So very, very important.
Yeah.
Take
Because I'm
that.
definitely more patient when I'm happier. Do you know what I mean?
Yeah, we are.
When I'm sad, I'm like, you kids
Or
are driving
tired.
me insane. But actually, when I've like had a nice day, maybe done something, even if it's just like having lunch quietly, those small things make such a difference to your moods. Yeah.
For me, it's hot tea. I haven't had a cup of hot tea until I went to work yesterday.
Because you make it and then it's nappy. Oh, she's crying. Oh, yeah.
Believe it or not, I got used to cold tea. That yesterday hot tea, I couldn't drink it. I was like, oh, why is this hot still? You know?
Yeah, and I'm sure there's like lots of contributing factors that could, lead to postpartum. It could be people struggling financially.
Yeah.
There's a few factors. So having all the outside stresses. So if you're a single parent, if you have money troubles, if you have job troubles, some people don't get your maternity package, or your pay won't be enough. How are you going to be able to balance everything? Having a partner who's unable to take time off. So even if they're there, you're still on your own. There's a lot of factors, but also there are some very identifiable factors that kind of alert your doctor or alert your midwife to kind of take a little bit more time with you. And some of them include somebody who's already had a history of mental health problems, like somebody who's gone through depression before or anxiety before. You're more prone to develop postpartum depression. Somebody who has had low mood during pregnancy, there's a little bit more push for you to kind of go even lower after baby is born. Somebody who doesn't have that support system around, somebody who's all on their own. And I'm not saying that we all have the luxury to have a whole village around you, but if even if you have one friend who you're able to speak to, I think that makes a world of difference. So there are those aspects where if you've had all these all these signs, then I would suggest actually bring it up with your midwife when you're pregnant to say, and that's the start in itself, because you are flagging it up so that you don't go down that road, or even if you do, if you're unable to identify it, somebody else will, and you will get the right support then and there. And the other biggest thing is how your birth goes. So if your birth isn't as planned, which it never is, I mean, you can make all the plans in the world, but even if you go through a very traumatic birth, that's another one that might trigger, because you're unable to resolve your emotions, and you're already moved on. You're discharged, you have a child, you have this, you have that, like a million appointments to go to, and there's so all those factors kind of play in, but the external factors, mind you, don't go away. So it's not like now that you have a baby, all of a sudden, you've won the lottery and now your money troubles are gone. No, they're all still there. Plus there is all of this. So it builds, it kind of compounds, and it builds up.
Would you say it's possible as well for someone who's adopted a baby postpartum?
Absolutely. Yes. Because it's not about the giving birth that causes that. It's about having the responsibility of another human being. And I would go as far as saying that people who have adopted a baby might feel even worse, because the guilt is doubled, because they're like, this is something I wanted so badly that I went out and did this, and now I'm feeling like this. So it's even more, even more intense for them. So absolutely, and they should very quickly reach out for help. And don't worry, nobody's going to take your baby away from you. They will help you the right way to cope with your feelings and, be able to resolve them and, have happy mom. Happy mom.
Because I feel like a lot of the anxiety around that stage is about fear. Fear that you're doing it wrong, fear that you're going to hurt the baby, fear that, do you know what I mean?
Yes, absolutely. And one more scary symptom of postpartum depression that I would just like to touch upon. I don't want to scare everybody, but even having thoughts of harming your baby is also it's quite real.
Yeah.
And we've all heard stories about people with extreme postpartum depression who have done things, but what we don't want is to reach that point. Basically, we want to be able to intervene before. We want to be able to help in the right way, channel it right, and eventually get best for mom and baby.
Do you think that comes from almost like when you hear those cases of women who've harmed their baby, do you think that's normally because they see it as like their way out, like their escape? Like if the baby's not here, maybe I'll stop feeling like this, or...
No, I don't think there is a rationality there.
Okay.
Yeah, that's a personal opinion. I don't think it's any, because when you're in a very low state, you can't rationalize anything. Nothing of reason makes sense, So it's just, and that's why I mean, take the postpartum bit out. Even if you're just generally depressed, you can't rationalize anything, So I don't think there is a reason for all these things. It's just that it's supposed to be kind of helped in the right way, so that they can get treated the right way.
And I think in those instances, there becomes a blur between reality and like what isn't real. So I think I read a story about a lady who was going through postpartum depression, and it started quite early on. Like her husband was trying to help her, family was trying to help her, but she actually didn't see any way out. And then she said at one point, she heard like a voice telling her that this is your only way out, to harm your child. So I think for other people it can be different, but when you're in that state, you actually don't know what's real and what isn't. I guess you become so desperate that you just want to be free of these emotions. I think the best way to do that is to let those around you help you, even though it's hard, especially as women. You're used to just doing stuff by yourself, just getting on and be like,
cry in the toilet and then wipe the tears and go back to work.
Like, you see so many memes saying, I just need to cry and then I'll be okay. But sometimes you need to take that further step after crying. Like, what are you going to do after crying, so that you're not stuck in that place, or you don't go back to that place as well. So I think utilizing the people around you, as much as we don't like it, it doesn't make us any weaker or any softer, because everyone needs help eventually, and the best thing you can do is to get help, like Alishah said.
I think just moms in general, or just women in general, actually, we're just so used to being the people that people ask help. Other people go to, and not people who ask for help. That some of us don't even know how to
especially mums.
do it.
I feel like because we're maternal, we're so caring anyway.
Yeah, that's right. And we don't know how to ask. That's the thing. Like I don't know how to ask for help. Like I would be like, oh, I'm tired, but I'll do it anyway. But yeah. So that's why I keep going back to the same point. Is just voice it. It's okay to have those feelings. And if there's one message we can take away from today, it's okay to feel that way. Just voice it.
It's interesting what you touched on about bottling it and it coming out worse later, because the moment I knew something was wrong, and I still didn't know it was postpartum, is when all the plates in my house got smashed. Like literally, the kids that didn't do the washing up. What do you mean? You did this one thing I asked you to do. Right, no plates in the house, and they got smashed. And River was about 8 months at that point, and that's when I said I'm getting out of it, and I took her with me to my sister's house to get away from it all. But like, it's so scary to think that you could be like, she was 8 months old, so this had been going on for months, and it was only me being quite self-aware, realizing, okay, you don't normally smash plates, something's wrong. And I still at that point didn't think it was postpartum. I just thought I was being moody. So like, what would you say to anyone who is like dealing with all this, feeling really like something's wrong, but they can't really nail it? I know we said talk to someone, but is there anything else that you'd advise them to do, like to support themselves in that moment, or to be more aware of what's happening?
I think the one thing that you said, and you very aptly said it, was self-reflection. Self-reflection is very, very important. Just if you take 2 seconds, step back and just say, this is not me, you know. The other thing that you kind of touched up on without really saying it is a lot of us, especially moms, we're very hard on ourselves and we always blame things on hormones.
Yeah.
Most times it's not.
Yeah.
Sometimes it is, and you know,
brain.
and baby brain. But those are all things that I feel like those are excuses we tell ourselves to make ourselves feel better. But if anything, we're not acknowledging what we're feeling. We're just blaming it on something.
Right.
And that's not right. Take a step back and say, okay, well, I've been hormonal before. I've never smashed plates, you know, or I've had a certain feeling before, but I've never done this. So self-reflection is very important, and the only way you can do that is if you take time.
Yeah.
If you take time, if you just shove everything and keep going, you're never going to get to that point where you realize. So even if you feel like something's wrong, and it might not be, it might just be a matter of, you know, I just had a bad day.
Yeah.
But if you feel like something's not right, voice it.
Yeah.
Even if it's to a partner, to mom, to best friend, to sister, to anybody, just voice it. And the response you might get is, oh, I felt the same thing, you know.
Yeah.
Or you might go, oh, hang on, this is a bit much, you know.
Yeah.
So that way you will be able to tell
Yeah.
whether or not a certain reaction is appropriate and what is not, and how far, you know, you have to do. So if you're unsure, speak to somebody.
Yeah.
If you're sure, speak to somebody.
What would you say if say we speak to our trusted person and they're kind of like, oh, it's normal, don't worry about it, you'll be fine. So like they really dismiss how you're feeling. Is that when you'd say talk to your health visitor or your GP?
That's it. That's where I'll be like, and we've done that before. We've always chatted with a friend that we're like, oh, hang on, that's not the response I was hoping for.
Yeah.
And then we just go to somebody else, and that's okay, okay. But what I would say is, I think the one piece of advice that you should never take is, you'll be fine.
Yeah.
You know, just don't take that, because you will be if you get the right help.
Yeah.
You know, you won't be if you just kind of shove it down.
That's kind of equivalent to basically saying just get on with it.
Yeah.
Yes.
And I used to hear that a lot. It's just, well, just get on with it. Like, it's just a part of the...
Or parents who tell you, we did it too.
Yes.
You know? Yes, but you know, times have changed. We are actually trying to, you know, we're not wanting to repeat what happened with them, that, you know, they just had to deal with
they were
it.
living in the survival mode, and we're not in that mode anymore.
We're not, exactly. And there is help out there. It's just a matter of asking for it.
And I think also be sure about how you feel, because you might tell someone and then they'll be like, oh, it's normal, and then you'll sort of psych yourself out of saying, okay, actually it might be normal. I think be sure, don't let what other people say sort of make you diminish how you feel. If you really feel like this is how I feel, go to someone else, like you said, until you get someone who says, actually, you're right, this isn't how you should be feeling, this is what we're going to do about it as well. I think personally, I've not grown up in a home where you can speak freely about so you might go and tell someone, like an uncle or something, this is how I'm feeling, and their first response might be, what have you got to be stressed about? You know, what have you got to be stressed about?
Pray on it. That is another one. Like just, you know,
we've had it
pray
hard.
And you will be fine. You know?
Yeah. Or like someone else saying, do you know what? I've had it 10 times harder. But it's like, you shouldn't allow someone else's experiences to make you feel like yours is invalid as well. So I think stand on how you feel and be your own champion. Like, be your own voice as well, and be like, this is how I'm feeling. I need the help, sort of thing. Yeah.
So this chat's going way too well. We're going to have to make this a two-parter.
Well, we're going to have to. This is too juicy.
So make sure you stay tuned for next week's part 2.